Hi, my name is Dr. Manav Bauer. I'm a cosmetic doctor here at Time Clinic. Today I'm going to be talking to you about HArmonyCa, our fantastic hybrid biostimulation products that we've been achieving fantastic results with. And I can't wait to share lots of information about this product with you today. So as we age, we must remember that there are changes in every layer of the face. So for example, let's start with the skin. So the skin loses its elasticity as we age, so it starts to get crepey and potentially sag. It also loses the collagen within the skin, so we get the fine lines and wrinkles. Now if we move below the skin, we get to the fat. And we've got these fat pads throughout the skin, and what happens is they shrink. So we haven't got as much volume holding the skin up in place. So what happens? The skin starts to sag down, causing these lines, the jowling, and the hollowness under the eye. We also lose some of the bone. So as we age, the bone reabsorbs. And so what happens is, again, we lose structure underneath the skin. So normally we have these full cheeks and a full chin. But as we age, we get the hollowness around the mid-face, and so the skin starts to come down. And we also get a receding chin, which contributes to the jowling as well. So within our treatment plan, we've really tried to focus on every area that we can improve and help you with to achieve fantastic holistic results. And remember, it has to be natural as well. So this is HArmonyCa. And HArmonyCa has a hyaluronic acid component, which is the HA, and also the second part, which is the calcium hydroxyapatite. Now, what the company have done is combined those two products. So we have a filler type component and a calcium hydroxyapatite component. And so when joined together, we get an initial lift, and then the calcium starts to biostimulate your own collagen to really improve the skin texture and to lift over time. So we're seeing an initial result which gets better and better and better over the next 3, 6, and 9 months. This is HArmonyCa. What is collagen? So collagen is a protein contained within the skin. What happens as we age is we start to lose that production. So we've got a great production, and then when we get to about 26 years old, that production starts to tail off and then comes down. So what we're trying to do with a product such as HArmonyCa here is to stimulate our own collagen production. So what happens is, when you're treated with this product, the calcium hydroxyapatite within the product stimulates your own collagen, resulting in a lift that continues lifting over time, which in turn helps with some of those fine lines here. There are other products on the market that contain calcium hydroxyapatite. However, this is different because the medium that we use to deliver that calcium is the filler component, so the hyaluronic acid component of this product. So what happens is, as we deliver this product to the skin, we get an initial lift, as an example, and that stays. So we don't lose that initial lift. Then what happens is the product really starts to kick in. So we get that biostimulation of your own collagen. And so that lift gets better, better, better. So a great thing about HArmonyCa is it contains lidocaine. Now, lidocaine is a local anesthetic, so as soon as the product starts being deposited within the skin, it starts to really achieve a numbing and more comfortable effect for patients when we're treating them. So HArmonyCa was used worldwide, especially in Brazil and Israel, and then one of the global pharma companies obtained the product and rebranded it as HArmonyCa. And now it's been introduced into the UK. So we're very excited. We've been using it now for some time, and we've seen some great results, and those results are getting better and better over time. Why is HArmonyCa different from Dermafiller? Well, Dermafiller contains hyaluronic acid for an instant, let's say, lift. HArmonyCa also contains hyaluronic acid, but it also contains calcium hydroxyapatite. Now, with HArmonyCa, we get a gentle initial lift because of the HA or hyaluronic acid content, but the calcium hydroxyapatite stimulates your own collagen formation. So that initial lift will get better and better and better over the next 3, 6, 9 months. Now, each have their own place. So Dermafiller definitely has its own place for creating the foundation and contouring of the skin and skeletal structure to really help lift, help with the hollowness, help with some of the fine lines. But some of those difficult areas to treat, such as the accordion or smile lines, so the ones that go like so, that's where HArmonyCa has its place. And it is fantastic to, again, lift and continue lifting over time. So it certainly has its place within the range of dermal fillers. So which patients are suitable for HArmonyCa treatment? So really those patients who want to positively age, patients who have found that their skin has started to sag, so may see signs of nasolabial lines, marionette lines, or jowling, as well as loss of definition of the jawline and even loss of definition of the cheekbone. So we can also treat patients who have what we call smile lines here, or accordion lines, as well as some of these lines just lower to the corner of the eye. Other great patients to treat are those with saggy skin, or those with lots of fine lines, so a crepey texture to their skin. And the reason is HArmonyCa will stimulate your own collagen to really help smooth and lift the skin to help with some of those concerns. So how long does HArmonyCa last? Well, we're saying about 12 to 18 months, so there is a good longevity with this product. So what's the aftercare following your HArmonyCa treatment? Well, I normally say for you to go back and massage along the cheekbone, just under the cheekbone, and along the jaw and upwards. And to do that with moisturizer, for example, every evening for 30 seconds until we see you back in clinic 30 days later. I also say on the day of treatment, try not to apply any makeup to reduce the risk of infection, and for a good 24 hours avoid alcohol, saunas and extreme exercise, and that's to reduce any risk of bruising or swelling. Other than that, patients go straight back to work.